So I'm J S Bamrah. I'm a psychiatrist, senior psychiatrist in the NHS. I'm also the past chair of BAPIO, the British Association of Physicians of Indian Origin, and and I'm a member of UPNA NHS. Well, we know that over all these centuries that the traditional places for NHS workers didn't actually get us the recognition of our culture, the recognition that we have particular areas that we need support with, education, training with. And what has happened is that with UPNA, NHS, BAPIO and organizations like that, it brings together like-minded people in order to make sure that we can actually perform at our best. There's peer support, there's all sort of encouragement, leadership groups, everything there that helps us in order to try and really work to our best for the benefit of organizations and for patients. So this conference, which is, the first thing is the variety of topics. So the traditional medical way has been you talk about your particular area of specialism, and that's it. Where the UPNA conference and the BAPIO conference, what they do is they bring a variety of topics that are precious to us, which are not clinical necessarily. And that is why there's a really, UPNA have the conference this weekend, BAPIO have a conference on the 6th, 7th and 8th of October in Manchester. So what they do is they bring together people from all areas. And the idea is really, it's not necessarily for, as is in UPNA, it's not just Asians who come, people from all over the continent come, and the same thing for BAPIO. So you have a mixture of people there, which is, I think, so rich in terms of our diversity. So what I've always been passionate about is mental health, because I'm a psychiatrist. That's why I chose to do psychiatry. And the issue that we're bringing today with my colleagues Mel and Ananta is to look at parity of esteem. We do believe very strongly that mental health doesn't get the right slice of the cake in the NHS as physical diseases do. There's a lot of stigma and discrimination, not just within ethnic groups, but across the NHS when it comes to funding, when it comes to treatment of ethnic people, black and ethnic minorities, in terms of their diagnosis, in terms of seclusion, in terms of how they're treated through the judicial systems as well. And what we're trying to do is to highlight them, but also give reasons why we need to tackle it and how we can tackle it. So that's what I'm very passionate about.